Hello, this is Anthony, and this is my professional development video. This class has helped me learn and understand complex modalities I never used before, like diathermy or ultrasound. Even ones that are simple that I used before on myself that I thought couldn't really be used wrong, like an ice pack or a hot pack, have times when they could be contraindicated and not beneficial. This class further shaped my idea of a PTA by showing that the job isn't just giving the patient exercises and stretches to do, but also showing how we can treat them in the clinic using all the special equipment we have. We can use things like ultrasound to do things like phonophoresis and apply medication to them. A key takeaway is to not just memorize the parameters and contraindications, but try to think critically why you would not want to use it on certain patients and why you would only have it set so high. And then this could help me later in the clinic because knowing why we set the parameters up this way will help me to later remember things like having a 2-second ramp up time on E-stim because I know it helps ease into the contraction and so it doesn't happen so suddenly it's uncomfortable or scary for an injured patient. Knowing why will help me for in the clinic if I ever have to make adjustments or changes based on the patient. The other takeaway is to keep practicing these modalities. Learning and doing them a few times is good to be familiar with them. But for things like the compression wrapping or massage, it's going to take practice to become better at and not forget the technique. Practicing these skills and talking points at home in the clinic will help me to continue learning and improving on them. And then I found that the guided readings were very helpful as a way to look back on some of the key points of the chapters. Looking over those before a quiz or an exam made me feel much more confident in my answers. Thank you for teaching us this semester. I enjoyed learning all about these modalities a lot. I'm glad I didn't have any contraindications and I was able to feel all of them on myself, so I know what the patient is going to feel a little bit better now. Thank you again.